Hi, I'm Catherine Lido, and welcome to Topic 6, Health Psychology and Adult Learning. So this is an overview, a little bit about what we're going to talk about today for your reference. But a lot of health psychology is about motivation. It's about motivating people to change. It's about motivating people to engage in healthy behaviors. It's about motivating people to achieve their goals and live better, healthier lives. So how do we define motivation? A lot of people think of health psychology and they relate it with things like sports psychology and coaching. And although these are sort of related, it's important to know that there's a lot of sort of lay theories out there which maybe aren't that scientific. It doesn't mean that they're not interesting and they're not useful, but motivation can be defined really, really broadly in terms of anything that will help you self-actualize. So here we've got the goals, reality, options, will approach, the grow approach. You've got over here learning tips for effective instructors. You've got a lot of leadership coaching for motivation in the workplace, and you're welcome to explore these in your own time. But what I'm going to talk to you about really is the psychological theories that have spawned so many of these lay conceptions. So the first one is probably motivation drive theory. This is the notion that we have an innate need to have sort of a state of homeostasis or balance. So if there's something that we want, it creates a physiological need. It arouses a state of tension and it motivates us to satisfy that need. You can see this most easily in hunger or thirst, but you could also see it in the workplace in terms of attaining status, power, or money. There's other theories that have risen from this, and you can see how they're sort of related to Maslow's hierarchy of needs, sort of meeting your basic needs first and moving up towards your self-actualized self. Herzberg's two-factor theory, Alder, Fur's ERG, existence, relatedness, growth, Dici's self-determination theory, I'll talk about it in a minute, and all of these have led to things that are used in adult learning, such as setting SMART goals, specific, measurable, attainable, relevant, time-based. So feel free to go further and look at these approaches, but the most important of these that have spawned out of Maslow and the motivation drive theory is self-determination theory. And this is really used in adult learning because we talked about Knowles's idea that adult learners are more individually motivated. They're more self-determined on average than your average school child. So this is really a meta theory. That's a theory that spawned out of all of these theories. It's almost an organizational framework to explain how adult learners come to this situation as more self-motivated. And the reason is that a lot of times their reasons for learning are more intrinsically motivated. It's more for what they want to do, not what they can get out of it, or not because they have to. Sometimes adult learning is about workplace learning and it is mandated, but often we learn because we want to, because we're interested. And that is really important in achieving your goals. Higher intrinsic motivation yields more goal-directed behavior, more persistence, and it's really quite a powerful tool in adult learning. So I put some references here for you to go ahead and read a little bit more, but the idea is that autonomy, competence, and a sense of relatedness leads to more motivation and engagement, which allows you to increase your performance, your persistence, your creativity, and achieve your goals. But the main models stemming out of health psychology tend to be the health models. So the health belief model would be the first of the health behavior models. And I happened to work with Ed Serafino, who developed this model. I won't go too much into it except to say that it is a precursor to these two later theories, the theory of reason action and the theory of planned behavior. All of these models are trying to predict the likelihood of engaging in things that are good for us, healthy behavior. But the difference between the original theories is that Fishbein and Eisen realized that often our intentions don't predict our behaviors. So in theory, if I really, really want to be healthy and have a really strong intention, you'd think that the likelihood of engaging in that healthy behavior is actually going to be increased. But unfortunately, that doesn't seem to be the case. I can have every intention in the world to go to the gym tomorrow morning at 6 a.m., and yet when the alarm goes off, I still don't go. And so that's why they try to decompose this theory of blend behavior to say, what are the influencers that might prevent or promote my intention becoming a reality? And so they thought that this could be something like having a positive attitude towards that behavior. So is it easy to do? Is it useful to do? Is it compatible with my general beliefs? Subjective norms. What would my friends and family think? Are my friends going? Will it be something that people think good of me? And the final one, the most important one probably, is perceived behavioral control. Having a sense of efficacy in the world, having a sense that you can in fact accomplish something, is a really good way of strengthening whether you'll actually do it. So self-efficacy, conditions that facilitate it happening, and even technology that can make it easier for you to accomplish it, is all going to strengthen the likelihood that you go to the gym in the morning. So just to unpack self-efficacy a little bit more. So as I said, part of perceived behavioral control is having high self-efficacy. That doesn't just mean self-confidence or self-esteem. It's really almost a sense of empowerment. It's a personal belief that you can in fact achieve that goal. And it's a very, very powerful tool in adult learning, because a lack of self-efficacy, as we know, leads to learned helplessness, feeling that you can't do it, a feeling of giving up. So here's just a little fun study. Some people I work with, Charles Abraham and Ian Keller, have worked on implementation intentions to try and strengthen the likelihood that your intention will become a behavior. And they do it in a really, really simple way. You basically think about something you want to change, and you write a "when blank, I will blank" statement. So if I really wanted to go to the gym, I might say, when my alarm goes off in the morning, I will turn on the light and get dressed. And you have to write it, and it has to be somewhere prominent. And if you do that, you're basically specifying the when, the where, and the how of that goal-directed behavior. So if you want to reduce your caffeine consumption, would become, if I get a craving for coffee, then I will drink a water. So it's just about changing the way that you phrase things in order to strengthen the likelihood. So go ahead and try it. That's your homework. Write it on the fridge. If I want candy, I will eat an apple, something like that, and have a go and see if you can create some positive behavior change. So another really powerful offshoot of health psychology, or related to health psychology, is this notion that not just our physical body affects our health and also our learning, but our mental health is very closely tied with our physical health. So health psychology deals a lot not just with keeping physically healthy, but with keeping mental healthy as well. And mindfulness has become a very powerful tool in psychology, in classrooms and out of classrooms, for creating mental health. And we've got here, your mind is full or your mindful. Okay, so ask yourself today, are you feeling mindful? Are you feeling mindful? Which one? So obviously this is an ancient Eastern practice. It's thousands of years old. It's not something that psychologists have come up with. It is a primary practice of Theravada Buddhism, but it exists in a lot of different countries and a lot of different cultures. It's to give you insight into the true nature of yourself and reality. And a lot of, for instance, mindfulness-based approaches focus on attention and awareness in the present moment, examining your emotions non-judgmentally, viewing them and letting them go, opening your heart, practicing loving kindness. And these are all things that can really help promote mental positive health, and has led to creation of mindfulness-based stress tools, mindfulness-based stress reduction, mindfulness-based cognitive therapy, acceptance and commitment therapy, dialectical behavioral therapy. These are all offshoots of using meditation and mindfulness. There's a plethora of empirical research that this can help with fear, pain, depression, and we're just starting to learn about the way in which it can actually help your neurons create new neural networks and pathways, or neuroplasticity, It's even possible that practicing these things can help, in theory, the field of epigenetics says it could help with which genes are activated, switched on or off. But I think the most evidence is really for what it does to your amygdala. Your amygdala is your flight or fight sensation. And as you can see, most of us are operating in this zone where we're sometimes maybe too flat, but often we're too high and we're too low. And the idea with mindfulness is to get us in this nice, resilient zone. So this brings me to how we apply it in the classroom. Health psychology's message for us is about active learning, and not just active learning theoretically. Physically active learning. Engage the body, engage the mind, and don't treat the two as separate. Don't treat our brains as on a stick. There's a mind-body connection here, and that's why it is related to sports psychology. It is related to lots of different things going on in the real world. We can see it in active learning studies, not just passive listening, but students are getting involved. And then when you recruit different senses, you actually remember things better. The flipped classroom is something where the student becomes the active facilitator of the knowledge. And such things just provide a deeper learning of these constructs. I also strongly suggest yoga and Pilates. Studying can be a very physically intensive experience, and it's really important that we don't neglect our mind-body connection. So there's, what is that? Oh, that's just my mind. Let's not be this person on the right-hand side. Let's try and be the person on the left. So that's it for today. Go ahead and practice some deep breathing. Go ahead and practice some visualizations. Go away, try some Pilates and some yoga. And I'll see you for the next topic on cognitive psychology. Thank you.